Okay, good morning. Today, for the topic, I will be presenting about the hormonal control during the exercise lah. So our objective in this topic now is we need to know how the importance of the hormones in making adjustment of maintaining the metabolic system and also hemostasis in our body during the physical activity. So first of all, for the endocrine system, what is the definition of the endocrine system? It is defense of the glands, tissue or the glands that secrete the hormones. So what is the glands is the gland is the tissue that can produce or secrete the hormone, while the hormones is any chemical which is secreted by the glands that control and regulate the activity of the target cell. So for the classification of the hormones, we have the two category, which is steroid and non-steroid. For the steroid, we know as a lipid soluble, which is it can easily through the cell membrane. For the non-steroid, is lipid soluble. That means it has need for the second messenger to deliver the message and then to regenerate the RNA. So for the steroid, there is several hormone that we know, which is we have aldosterone or cortisol, which is secreted by the adrenal cortex, and then estrogen and progesterone from the ovaries and placenta, and also the testosterone from the testes. While the non-steroid hormone, we know there are two subdivided group, which is amino acid and peptide hormones. Amino acids, there is, for example, the thyroxine and triiodothyronine, which came from the thyroid, and then epinephrine and norepinephrine secreted by the adrenal medulla. For the second group is the peptide hormone. This is a lot of the hormone here, but I want to mention about the ACTH, amylin, and angiotensin. Okay, so in this topic, we need to know how the hormone was regulated in terms of the role of the metabolism during the exercise. First, we need to know what is the major endocrine glands and what is the metabolism of that endocrine gland. The second one is how the metabolism glucose and fat is affected. So for the major endocrine gland, we have four for the major endocrine gland. The first one is anterior pituitary. This is the maple size was attached at the hypothalamus. Consists of 3 lobes, anterior, posterior, intermediate, but the major role in the exercise only function for the anterior and posterior, while the intermediate only have a little role in the secreting hormone. So there is 6 types of the hormone in the response of the releasing or inhibiting the factors, which is 4 tropic hormones. Tropic hormones means is used for the another organs, which is TSH, adrenocorticoid thyrophine hormone, fasciculating stimulating hormone, and luteinizing hormone. So the another two is growth hormone, which is the most important in our exercise metabolism, and also the prolactin. Prolactin is used for the secreting for the breast milk. So in this hormone, we only focus for the growth hormone, which is it's anabolic agent. During the exercise, it will promote for the muscle growth and hypertrophy of the muscle by facilitating the amino acid transport into the cells. So the second role of the growth hormone also it used for the process lipolysis process. So the second major endocrine gland which involved in the exercise is thyroid glands, which is located below the larynx and the midline of the neck. The two important hormone was secreted by this gland is T3, which called as triiodothyronine, and also the T4, which is thyroxine. So what is the function of these two hormones? Is actually to regulate the metabolism in general, and then the assist in regulating calcium metabolism by secreting the calcitonin hormone. It was also to increase the basal metabolic rate, which can up until 60 to 100% during the exercise, and then can increase the protein synthesis, and then increase the size of number of mitochondria so that can produce more ATP, promote rapid cellular uptake of the glucose, and then enhance of the glycolysis process and also the glycogen gluconeogenesis process. And the last one is enhance the lipid mobilizations, FFA mobilization. So the third major endocrine is adrenal glands. For the adrenal glands, they're divided into the inner and outer, which is the first inner is adrenal medulla and the outer is adrenal cortex. What is the hormone was secreted by the adrenal medulla is epinephrine or norepinephrine. Norepinephrine we also known as adrenaline, taken name from the adrenal lah. So while the adrenal cortex, the hormone secreted from this side is cortisol and glucocorticoids. So we focus on the adrenal medulla first. Is usually involved in the sympathetic nervous system, which is produce fight or flight response in our body lah. So what is the effect is that it can increase the heart rate and force the contraction of the muscle, increase the basal metabolic rate in our body, and then increase the glucogenolysis in the liver and muscle. It can also increase the blood pressure and release of the glucose and free fatty acid into the blood. I mean the break down the fat metabolism to become to make for the energy. And then the last one is redistribution of the blood to the skeletal muscle. For the adrenal cortex, the function or the effect is stimulate the gluconeogenesis, increase the mobilization of the FFAs, and then making more available as energy sources, decrease the glucose in utilization, stimulates protein catabolism to release amino acids. This is for use in repair enzyme synthesis and energy production. The fifth one is it can also act as an anti-inflammatory agent. So the third organ is pancreas. In pancreas we have two major hormones, which is insulin and glucagon. For the insulin effect, it facilitate glucose transport to the cells and promote gluconeogenesis. And also inhibit the gluconeogenesis. Okay. While the glucagon effect is to promote the glucogenolysis and promote gluconeogenesis, is the counter for the insulin effect. So all these hormone actually is aimed to maintain the plasma glucose in the blood during the exercise. Okay, so what is the regulation of carbohydrate metabolic during the exercise? So during the exercise, our plasma glucose concentration actually it will go up and down. This is controlled by our hormone. So and also the glucose uptake by the exercising muscle. So actually in the exercise, there is 4 major hormones: glucagon, epinephrine, and norepinephrine, and also cortisol. Okay, for example, during the exercise, glucagon secretion will be increased, and then it will promote or will cause the glycogenolysis to produce more ATP for the body. So by glucagon secretion, it also can be enhanced or expedited by the catecholamine, which is norepinephrine and epinephrine lah. So usually after the 30 to 45 minute exercise, the cortisol hormone level in our body will be increased. They mean after the 30 to 45 minutes, after we use all this glucose in our body, it will become depleted. So the cortisol will take over the role. So it will result the gluconeogenesis process, which is freeing the amino acids from the fat to become the glucose lah. So amount of the glucose release, it depends on the intensity and also the duration of the exercise itself. The greater of the exercise intensity, then the greater of the hormone release will be occur. So it will increase the rate of the glucogenolysis. This is the graph which is show us for the change of the plasma concentration of the hormone during the 3 hours of cycling. Okay, so from this graph we can see the blue color, the purple color is the glucose, which is the level is constant, we can say is constant remain. The cortisol for the first 30 minutes, it will become in low level, but after the 30 minutes, it will spike up to produce to help in the process break down the free fatty acid and also the acid amino to change for the ATP lah. So the red and yellow color is shown epinephrine and norepinephrine, which is constantly increased when the following the time of the exercise. And then the glucagon, we can see after the 60 minutes, it will from the 0 minutes until the 60 minutes it increase, and then after that it become the plateau. That means the production of glucagon reach until the limit lah. So this is the glucose uptake by the muscle. Okay, glucose and insulin during the exercise. We know glucose level in the body will become reducing according to the following by the time of the exercise. They mean insulin level. Okay, this graph actually show us changes in plasma concentration of the glucose and insulin during the prolonged exercise lah. So gradual decline in insulin suggesting increase of sensitivity to insulin during the prolonged effect. So this graph is showing us the more time of the exercise person doing, the insulin become more sensitive. That means the production of the insulin is reducing, but the rate of the metabolism in terms of the changing the changing in terms of making of the glucose to become ATP is the same lah. Okay, alright. For what is the regulation fat metabolism during exercise? Okay, during the high endurance exercise, oxidation of the fat, which is a lipolysis process, happen to ensure muscle energy needs to be met. So in this process, the FFAs, which is derived from the triglycerides, through the action of the enzyme lipase, will be break down to the FFA and also the glycerol. So this process, lipolysis process, is controlled by the insulin, epinephrine, norepinephrine, cortisol, and also the growth hormone lah. For the fluid and electrolytes, there is two endocrine glands functioning in this process, which is posterior pituitary and adrenal cortex. For the posterior pituitary, during the exercise, muscular activity, we already know muscular activity was increased, and also we producing a lot of sweat. That means will cause the fluid losses, and also the electrolyte become concentrated in our blood. So it will cause the hemoconcentration state, and also it will increase the plasma osmolality. So what happened is from the body or from the plasma, it will send the signal to the osmoreceptor at the hypothalamus. So it will trigger the posterior pituitary to release the antidiuretic hormone. So once antidiuretic hormone was released by the kidney, it will travel to the kidney, and then will cause the increase of water permeability at the renal tubules and also the collecting ducts, leading for the reabsorption of the water lah. That means water retention process will occur. So for the adrenal cortex, there is 4 group of the hormone called mineral corticoids, also important in the maintaining homeostasis for the fluid in our body during the exercise. So the aldosterone will promoting the renal absorption of the sodium, cause body to retain the sodium. So this also will cause the water retention. So the last major organ is the kidney, which is for the kidney, during the exercise you will release the erythropoietin, which is regulates the red blood cell production by distributing bone marrow cells, and then to increase the oxygen transport tissue, and also the removing the CO2, this is important for the adaptation and also for the altitude athlete lah. It also can regulate or for the if the plasma volume or BP was dropping, kidney will release the enzyme renin, which will convert the angiotensinogen to angiotensin, and then convert it to angiotensin 2 in the lung, and then it will cause the vasoconstriction and so increase the BP. Okay. Otherwise, angiotensin 2 also will trigger the release of the aldosterone, which promote sodium reabsorption, and then the water retention will occur again lah. Okay, so I think that's all. Thank you.